High blood pressure is universally known throughout the medical community as the silent killer, and it has earned this terrifying title for a very specific reason. Most people who suffer from hypertension feel absolutely nothing on a day-to-day basis, while it quietly and systematically damages the vital arteries in their heart, brain, kidneys, and eyes over the course of years or even decades. The true danger of this condition lies entirely in its complete invisibility. You cannot feel your blood pressure creeping up, and you cannot feel the microscopic damage occurring along the inner linings of your blood vessels. But when your blood pressure suddenly spikes to dangerous levels, or when it remains uncontrolled for far too long, the body does occasionally break its silence and send out distinct warning signals. Unfortunately, these critical signals are almost always misunderstood, dismissed, or blamed on other far more common and less threatening causes like stress at work, a few nights of poor sleep, dehydration, or simply the natural process of getting older. Today, we are going to decode the 7 hidden, crucial warning signs that your blood pressure has crossed the line and become a silent killer. We will explain exactly what these symptoms mean on a biological level, how to accurately tell the difference between everyday aches and true hypertensive emergencies, and what practical steps you must take to protect your organs before it is too late. Before we begin, please take a moment to drop a comment below sharing if you or a family member currently monitor your blood pressure at home and what your last typical reading was. Engaging with this community helps us share vital health tracking tips. Let's look at the first critical warning signal. The first major warning sign that your blood pressure has become dangerously high is the sudden onset of a severe or unusual headache, particularly one that strikes with intensity in the early morning hours. It is completely normal for many people to experience occasional tension headaches or hormonal migraines throughout their lives. But a headache that is directly driven by severe hypertension is fundamentally different in both its origin and its presentation. It very frequently presents as a dull, heavy, throbbing pain concentrated at the back of the head or the base of the neck right when you first wake up in the morning. This specific morning pain may gradually improve or lighten slightly as the day goes on, and your body assumes an upright position. But if you ever experience a sudden, explosive, severe headache, often described by emergency room patients as the absolute worst headache of my life, and this pain occurs alongside a blood pressure reading of over 180 of 120 millimeters of mercury, you are actively experiencing a severe hypertensive emergency. When your systemic blood pressure surges to these extreme crisis levels, it completely overwhelms your brain's natural ability to regulate its own internal blood flow, a critical protective mechanism known as cerebral autoregulation. When this safety system fails, the immense physical pressure inside the blood vessels forces fluid to leak out of the capillaries and directly into the surrounding brain tissue. This can lead to a terrifying condition called hypertensive encephalopathy, where the brain tissue actually begins to swell inside the rigid confines of the skull. If the numbers on your machine are dangerously high, this is not a headache you can just sleep off in a dark room. It requires immediate emergency medical care to prevent an impending stroke or a catastrophic brain bleed. The second crucial warning sign of silent vascular damage is experiencing blurred, double, or suddenly altered vision. It is an incredibly common coping mechanism for older adults to quickly attribute any newly discovered changes in their eyesight to simply getting older, assuming they suddenly need a new prescription for their reading glasses, or believing they are developing early cataracts. However, your eyes offer a direct, unobstructed window into the active health of your entire vascular system. The tiny, extremely delicate blood vessels located in your retina at the back of your eye are highly sensitive to even minor fluctuations in your systemic blood pressure. Consider the case of Margaret, a 64-year-old grandmother who noticed intermittent blurriness when reading her morning paper. Believing she was simply experiencing dry eyes or needed new reading glasses, she ignored the symptom for months. However, an eye exam revealed tiny retinal hemorrhages, a condition known as hypertensive retinopathy. When your blood pressure remains chronically too high over many months or years, these tiny retinal vessels can become physically damaged, Their walls can become thickened and stiff, or they can even begin to leak microscopic amounts of blood and fluid directly into the sensitive tissues of the retina. In the setting of a true hypertensive emergency, the visual symptoms are far more severe and terrifying. You might experience sudden, unexplainable double vision, begin seeing floating spots or bright flashing lights, or even suffer a sudden, complete loss of vision in one or both of your eyes. This sudden and profound visual impairment happens when sky-high blood pressure critically reduces the essential blood flow to your visual pathways in the brain, or causes an active hemorrhage to burst within the eye itself. Dismissing sudden vision changes as simple eye strain from reading or watching television is a dangerous and potentially tragic mistake. If your vision suddenly changes and your home blood pressure is elevated, it is a definitive medical emergency that could indicate an evolving stroke or severe, permanent damage to your optic nerve. The third unmistakable warning sign of a silent killer is experiencing shortness of breath, particularly when this breathlessness occurs while you are at rest, or when it physically wakes you up in the middle of the night. As we naturally age, it is very easy and convenient to simply blame feeling winded on being slightly out of shape, carrying a few extra pounds, or lacking cardiovascular endurance. You might easily notice that climbing a standard flight of stairs in your home, or walking out to the mailbox, leaves you gasping for air much more heavily than it used to a few years ago. But in the specific context of underlying high blood pressure, shortness of breath is a major red flag, indicating that your heart muscle is actively struggling and failing under a massive, unyielding workload. Chronic, long-term high blood pressure essentially forces your heart to pump much harder against increased physical resistance in your stiffened arteries. Over time, this constant, punishing strain causes the muscular walls of the heart, especially the left ventricle, to severely thicken and stiffen, a condition known as left ventricular hypertrophy. Because the heart muscle is now thick and stiff, it becomes far less efficient at properly relaxing, filling with fresh blood, and pumping it back out to the rest of the body. When your blood pressure spikes acutely, the struggling heart can completely fail to keep up with the sudden demand, causing blood and fluid to literally back up backwards into the lungs, a life-threatening, terrifying condition known as acute pulmonary edema. If you frequently find yourself feeling breathless while simply resting in your chair, struggling to catch your breath when lying completely flat in bed, or suddenly needing to prop yourself up on 3 or 4 extra pillows just to sleep comfortably without coughing, your heart is sending a desperate SOS signal. Sudden, severe shortness of breath that is accompanied by high blood pressure is a hallmark, classic sign of acute heart failure or an active heart attack, and it requires calling 911 immediately. Avoiding physical activity entirely because it makes you feel winded is a dangerous psychological compensation behavior. You must directly address the underlying pressure issue that is damaging your heart. The fourth warning sign that you must absolutely never ignore is the onset of chest pain, tightness, or a profound feeling of heavy squeezing pressure squarely in the center of your chest. Many older adults are incredibly quick to dismiss chest discomfort as simple indigestion, a bad bout of heartburn, or a minor muscle strain from lifting something heavy, especially if the pain seems to gently pass after a few minutes of rest. However, hypertension actively and aggressively accelerates coronary artery disease, narrowing the essential blood vessels that supply life-giving oxygen directly to your heart muscle. This creates a terrifying scenario of supply and demand ischemia. Your overworked, thickened heart desperately demands more oxygen to pump against the high pressure, but your narrowed, stiff arteries cannot supply enough blood to meet that demand. Consider the case of Michael, a 68-year-old retired engineer who considered himself to be relatively healthy, despite a long history of borderline, poorly managed high blood pressure. Michael started feeling a strange, heavy squeezing sensation deep in his chest whenever he carried heavy bags of groceries from his car to his kitchen. Because the pain went away when he sat down, he assumed it was just acid reflux acting up and started taking over-the-counter antacids after every meal. But one quiet evening, while he was simply sitting and watching television, the chest pressure returned with intense, overwhelming severity. This time, the pain radiated up into his jaw and down his left arm, and was accompanied by a terrifying home blood pressure reading of 190/110. Michael was actively experiencing a full-blown hypertensive crisis that was triggering acute angina and starving his heart of oxygen. High blood pressure not only exponentially increases the risk of a massive heart attack, but extreme pressure spikes can also cause an aortic dissection, which is a catastrophic, often fatal tearing of the inner layer of the main artery, carrying blood away from the heart. Any new, severe, or persistent chest pain occurring alongside very high blood pressure is an absolute, undeniable emergency. Never assume it is just spicy food or heartburn when your entire vascular system is under extreme, explosive pressure. The fifth warning sign represents a critical, time-sensitive neurological emergency: the sudden onset of weakness, numbness, confusion, or profound trouble speaking. These are the classic, unmistakable, and terrifying symptoms of a stroke, and chronic high blood pressure is the #1 leading cause of strokes worldwide. The delicate network of blood vessels in your brain simply cannot withstand years of pounding pressure. Sometimes, these devastating symptoms manifest as a sudden, noticeable weakness, paralysis, or numbness on just one side of the face, arm, or leg. A person might suddenly find themselves completely unable to hold a cup of coffee. They might have extreme difficulty finding the right words to finish a sentence, or their speech might become slurred and unintelligible. They might also experience a sudden loss of coordination, severe loss of balance, or profound trouble walking across the room. Tragically, family members and spouses often witness these strange spells in their loved ones and immediately write them off as extreme fatigue, an episode of low blood sugar, or simply having a bad senior moment. They might gently encourage their loved one to just lie down on the couch and rest for an hour to see if the strange feeling passes. This is unequivocally the worst possible action to take. When a stroke occurs, every single passing minute means that millions of irreplaceable brain cells are actively dying from oxygen starvation. Very high blood pressure can cause a weakened blood vessel in the brain to physically burst and rupture in a devastating hemorrhagic stroke, or it can contribute to a plaque breaking off and forming a clot that completely blocks blood flow, causing an ischemic stroke. If any of these neurological symptoms appear, even if they seem mild at first, you must not wait. Call emergency services immediately, as rapid medical intervention in a hospital setting is the only way to prevent permanent paralysis, severe cognitive decline, or tragic death. The sixth warning sign is experiencing frequent, unexplained dizziness, lightheadedness, or feeling dangerously unsteady on your feet. It is absolutely true that mild, occasional dizziness, when standing up very quickly from a seated position, can happen to almost anyone due to a momentary drop in blood pressure. But unexplainable, severe, or highly frequent dizzy spells in someone living with hypertension are deeply concerning and require immediate investigation. When your systemic blood pressure is wildly uncontrolled and swinging between extremes, it can severely interfere with the consistent, steady delivery of oxygen-rich blood to the delicate tissues of your brain. Extreme sudden spikes in blood pressure can directly cause dizziness, as can the dangerous, compensatory drops in pressure that sometimes inevitably follow if the heart's electrical rhythm is disrupted by the strain, or if your prescribed blood pressure medications are not properly balanced for your current biology. Older adults frequently and incorrectly blame these terrifying dizzy spells on mild dehydration, vertigo, or just a natural, unavoidable part of the aging process. But if you frequently feel as though the entire room is violently spinning around you, or you feel heavily woozy, faint, and completely off balance, and your home blood pressure is elevated, your body is loudly signaling that your core cardiovascular system is becoming unstable. Dizziness that is accompanied by a severe headache, chest pain, shortness of breath, or any numbness is particularly dangerous and strongly indicates an actively evolving hypertensive emergency. Ignoring dizziness and simply holding onto the walls or furniture to manually steady yourself as you walk allows the silent killer to continue its widespread vascular damage completely unchecked and unmonitored. The seventh and final warning sign is experiencing recurrent, heavy nosebleeds, especially when these bleeds are accompanied by deep facial flushing, severe redness, or a distinct pounding sensation in your head or ears. By themselves, occasional, very mild nosebleeds are quite common and are usually caused by dry winter air, seasonal allergies, or minor trauma. But when a nosebleed is incredibly heavy, extremely hard to stop with normal pressure, and occurs directly alongside a visibly red, flushed face, and a pounding rhythmic headache, it can be a highly visible indicator that your vascular system is currently operating under extreme, explosive pressure. When your blood pressure reaches absolute crisis levels, the incredibly delicate, microscopic capillaries located inside the mucous membranes of your nasal passages can simply rupture under the hydraulic force. While the nosebleed itself is not usually the primary life-threatening danger, it acts as a stark physical pressure release valve, violently warning you that the much larger, far more critical blood vessels throughout your entire body are currently facing the exact same extreme physical stress and are at imminent risk of rupturing as well. Many people dangerously minimize these frightening episodes, blindly blaming them on taking thin blood medications, changes in the barometric weather, or just having a sensitive nose, completely failing to ever check their actual blood pressure during the event. If you experience prolonged, heavy, or repeated nosebleeds, and your home blood pressure monitor simultaneously shows readings spiking into the danger zone of 180/120, this is a glaringly clear, undeniable signal that your body requires urgent, immediate medical assessment in an emergency room to bring the severe pressure down safely and controlled before a major internal vessel catastrophically ruptures. The tragic transition from a completely silent, manageable condition into a devastating, life-threatening cardiovascular crisis does not ever have to happen. You have the total power to protect yourself and your family by taking clear, definitive, and practical actions every single day. First and foremost, you must absolutely own a high-quality, reliable, medically validated home blood pressure monitor with a properly fitting arm cuff, and you must use it regularly. Do not ever rely solely on the random readings taken during your rushed, twice-a-year doctor visits to tell you the true story of your cardiovascular health. Check your pressure at different times of the day. Sit quietly for 5 minutes before measuring. Keep your feet flat on the floor, and keep your arms supported at heart level. Know your exact personal target numbers, and specifically, ask your primary care doctor exactly what specific reading should immediately trigger a phone call to their office or an urgent trip to the nearest emergency room. Second, never dismiss or rationalize the warning signs. If you ever experience a severe morning headache, sudden and unexplained vision changes, acute shortness of breath at rest, or crushing chest pain, do not simply take a painkiller, drink a glass of water, and go to sleep. Take your blood pressure immediately. If your reading is over 180/120 and you have any of these severe symptoms, do not attempt to drive yourself to the hospital. You must call 911 immediately and wait for trained paramedics. Finally, actively engage your family members in your health. If you notice a loved one experiencing sudden confusion, sudden weakness in their limbs, or frequent breathlessness when walking across the room, check their pressure and seek medical help on their behalf. High blood pressure has truly earned its terrifying title as the silent killer, simply because it is so incredibly easy to ignore as we go about our busy daily lives. For years and even decades, it works quietly and relentlessly in the deep background of your biology, stiffening your vital arteries, straining your overworked heart, and damaging your essential organs without ever uttering a single word of warning. But by taking the time to learn how to properly decode the body's rare but critical warning signals, you can effectively strip away its silence and take your power back. Michael, who experienced the chest pain we discussed earlier, survived his severe hypertensive crisis solely because his wife firmly insisted on calling an ambulance rather than letting him sleep it off in his recliner. Today, with the right combination of daily medication, a much lower sodium diet, and consistent daily walks, his blood pressure is fully controlled, his heart is healing, and his risk of suffering a repeat emergency has plummeted. Monitor your numbers diligently at home, listen to your body, and take decisive action. This video is for educational purposes only and does not replace professional medical advice. Always consult your doctor.